Heart attacks don't just steal lives, they destroy families, futures, and everything people worked for. In the United States, someone has a heart attack every 40 seconds. That means before you even finish watching this video, another person is rushed into an ER, often never expecting it. In Canada, the United Kingdom, and Australia, rates of cardiovascular disease are also climbing, despite better medical systems and more awareness. And while diet and exercise are critical, most people overlook the essential role of vitamins. Certain deficiencies can silently push your body toward disaster. Today, we're starting the first part of a critical 4-part series that could literally save your life. These are the top 8 vitamins to prevent heart attack, and you need to know every detail. We begin with vitamin D, often called the sunshine vitamin. Yet more than 42% of adults in the United States are deficient in it, with even higher rates in African Americans and Hispanics. It's not just about bones. Low vitamin D levels are directly linked with high blood pressure, inflammation of the arteries, and insulin resistance, all major triggers for a heart attack. The heart has vitamin D receptors that help regulate the function of the entire cardiovascular system. In a major Framingham heart study, individuals with low vitamin D had a 60% higher risk of heart disease. Next, vitamin K2, and this is not the same as K1, which helps with clotting. K2 is crucial for keeping calcium out of your arteries and pushing it into your bones where it belongs. Think of it as a traffic director for calcium. Without K2, calcium starts hardening inside the artery walls, leading to calcification, a major cause of blocked arteries and heart attack. In the United States, the standard American diet almost completely lacks fermented foods rich in vitamin K2 like natto, aged cheeses, and certain organ meats. That means millions of Americans are walking around with silent calcium buildup that no cholesterol medication can fix. In one European study, people with the highest K2 intake had a 57% lower risk of dying from heart disease. Yet, how often do you hear K2 mentioned during a cardiologist visit? Rarely. It's not taught widely in U.S. medical schools, and it's not emphasized in Canada or Australia either. When someone dies from a sudden heart attack with normal cholesterol, ask whether anyone ever checked their arterial calcification or their vitamin K2 levels. Because that silent killer doesn't show up on basic lab work. And if your arteries are turning into stone, no treadmill or statin is going to undo that damage. Third is vitamin C, but not for the reason most people think. Yes, it helps immunity, but its role in collagen production is absolutely critical for preventing artery wall rupture. Arteries are not just pipes, they are living tissue. They need strong, flexible walls. Vitamin C helps build that structure. If you're low in vitamin C, those arterial walls become weak and prone to micro-tears. That's how LDL cholesterol sneaks in and forms plaques. In the United States, with processed foods dominating the diet, the daily intake of vitamin C is often well below optimal. And in emergency rooms, they rarely measure it, even though scurvy, yes, actual vitamin C deficiency, is quietly making a comeback among older adults and low-income populations. This isn't a 1700s sailor problem anymore. In Canada and the United Kingdom, fruit and vegetable intake still falls short, despite all public campaigns. When your arteries weaken, it doesn't show up on a scan until it's too late. And when a rupture happens inside a coronary artery, the body forms a clot in seconds. That's the final trigger. The event that leads to a full-blown heart attack. All preventable if the arterial wall had remained strong. And yet, how often is vitamin C brought up in relation to heart health? Almost never. Ask yourself, how many people do you know with high stress, poor diet, and low fruit intake? That's a ticking time bomb. Vitamin C also reduces lipoprotein, 8IA, a dangerous genetic cholesterol particle that triples heart attack risk but is completely ignored in standard blood tests. Fourth on the list is vitamin B1, also known as thiamine, and its deficiency is disturbingly common, especially among older adults, people with diabetes, and those on diuretics. Thiamine plays a central role in energy production inside the heart muscle. When levels are low, the heart begins to fail to pump efficiently. This is often misdiagnosed as congestive heart failure or cardiomyopathy. In the United States, patients are frequently given medications to manage the symptoms, like diuretics that remove even more B1 from the body, creating a vicious cycle. In hospitals, heart failure is treated with high-cost pharmaceuticals, but rarely with intravenous or high-dose thiamine unless the deficiency is extreme. And guess what? Symptoms like shortness of breath, swelling, and fatigue could be early signs of low B1 long before the heart shows damage on an echocardiogram. One cardiologist in Canada documented cases where high-dose thiamine completely reversed heart failure symptoms in patients misdiagnosed for years. Thiamine is water-soluble and easily depleted by alcohol, sugar, and stress, all things common in the Western lifestyle. And in Australia, where heart disease remains the leading cause of death, thiamine deficiency is often missed even in people eating what they think is a balanced diet. White rice, white bread, and processed grains, these dominate food intake in many lower-income areas and are stripped of thiamine during production. Add to that coffee, which further depletes B1, and you start to understand why people feel their hearts slowing down even when they think they are healthy. How many times do people hear it's just aging, when really it's a nutritional deficiency? These are the first 4 vitamins every single person in the United States, United Kingdom, Canada, and Australia needs to evaluate today if they care about their heart. These deficiencies are silent. They creep in over time. And then one day, a father doesn't wake up. A mother collapses at work. A healthy-looking 40-year-old drops at the gym. Nobody ever saw it coming. But if you had tested the right vitamins, you might have. This is not about fear, it's about truth. People are told they're fine if their cholesterol is fine, if their EKG is normal, if their blood pressure is controlled. But that's not the whole story. Nutritional deficiencies are the silent foundation under almost every cardiovascular tragedy. And the sad truth is, most Americans never even get the chance to correct them. Fifth is vitamin B6, and its role in heart attack prevention is both underestimated and often ignored in routine care across the United States. This vitamin is critical for regulating homocysteine, a toxic amino acid that damages blood vessels from the inside out. Elevated homocysteine levels are like acid slowly corroding your arteries. It weakens the inner lining of blood vessels, triggers inflammation, and sets the stage for cholesterol to stick and form clots. Studies have shown that even mildly elevated homocysteine increases the risk of a fatal heart attack by nearly 50%. Yet, most physicians in the United States don't even test for it unless you're seeing a functional medicine specialist or paying out of pocket. In Canada and the United Kingdom, homocysteine testing is rarely covered unless there's a family history of early heart disease, and in Australia, it's barely discussed unless you've already had a stroke. Vitamin B6 helps convert homocysteine into harmless substances, working alongside folate and vitamin B12 to keep arteries clean and elastic. But here's what most people miss: chronic stress, poor gut absorption, certain medications like birth control pills, and even alcohol deplete B6 levels over time. People feel constant fatigue, mood swings, or tingling in their hands and feet, never realizing their heart is being damaged underneath it all. What's worse, common blood pressure and diabetes medications like hydralazine or metformin can deplete B6 even more. These patients are then told their heart issues are just progressing naturally, when in reality, their nutritional base is being stripped away silently. Real stories exist of people who thought they were healthy, active, and managing their diet, until one day they were rushed to the ER and the doctors found not cholesterol, but vascular damage and clotting they couldn't explain. No one thought to test B6. Vitamin B12, number 6, is absolutely essential, especially in older adults. In the United States, B12 deficiency is dangerously common among seniors, vegans, those on acid blockers, and people with gut issues. B12 doesn't just protect against anemia, it directly supports nerve health, brain function, and cardiovascular integrity. Just like B6, it helps break down homocysteine. But there's a darker side. When B12 drops too low, the myelin sheath that protects nerves starts to break down, and inflammation spreads into blood vessels. This opens the door to clots, high blood pressure, and heart attacks. You could have perfect LDL cholesterol and still suffer a massive cardiac event due to inflammation from B12 deficiency. In the United Kingdom, this problem is growing as more people move toward plant-based diets without supplementing correctly. Canada faces similar issues, especially among its elderly population, where B12 absorption plummets with age due to reduced stomach acid. PPI medications, which millions of Americans take for acid reflux, shut down stomach acid production and block B12 absorption completely. You could be taking your heart meds, eating well, exercising, and still be walking around with critical B12 deficiency, and you wouldn't know until it's too late. Even neurologists often miss the early signs. One woman in her 50s collapsed while walking her dog in Pennsylvania. Her blood work showed a normal cholesterol panel, but sky-high homocysteine and a B12 level under 200. She had been taking a proton pump inhibitor for 5 years. Nobody ever checked her B12, and the damage was already done. How many others are out there with similar stories, told their heart attack was bad luck or genetics, when the cause was slow and preventable? Folate, number 7, is not the same as synthetic folic acid. This is where things get very serious. In the United States, folic acid is added to many breads and cereals, but this synthetic version is not properly converted in people with MTHFR gene mutations, which affects more than 40% of the American population. That means millions of people are unknowingly walking around with unmetabolized folic acid building up in their bodies, while real folate remains dangerously low. Folate is needed to lower homocysteine, repair DNA, and support red blood cell production. But without the active form, methylfolate, the cardiovascular system suffers. Blood vessels become stiff. Clots form more easily. And the worst part is, this mutation is rarely tested unless requested. In Australia and the United Kingdom, the MTHFR issue is still considered controversial by some doctors, even though peer-reviewed studies have linked it clearly to cardiovascular disease, stroke, and even miscarriage. In the U.S., women are told to take folic acid during pregnancy, but few are told to check whether their body can even use it. People with this genetic mutation can end up with neurological damage, heart problems, and even autoimmune symptoms. In one Canadian study, patients with early coronary artery disease who were not responding to treatment were later found to have poor methylation. Once they were switched to methylated folate, their homocysteine dropped dramatically and their artery inflammation markers improved. The problem is, the food system and medical guidelines still push folic acid without warning about this genetic barrier. If you are part of the 40% with this mutation and you retaking the wrong kind of folate, you could be slowly increasing your heart attack risk every single day. Vitamin E, number 8, specifically tocotrienols, not just the standard alpha-tocopherol that's in most multivitamins, is one of the most powerful cardiovascular antioxidants. Most people in the United States take the wrong type of vitamin E, thinking it's helping their heart, when in fact, isolated alpha-tocopherol can act as a pro-oxidant in high doses, promoting inflammation and increasing risk of bleeding. Tocotrienols, on the other hand, reduce LDL oxidation, slow plaque buildup, and have been shown to reverse atherosclerotic lesions in some animal studies. In human studies, tocotrienols have shown remarkable benefits in reducing arterial stiffness and inflammation. Yet, hardly anyone in Canada, Australia, or the United Kingdom has even heard of this form, because it's not commonly found in standard supplements. The majority of tocotrienols come from annatto, red palm oil, and certain grains, which are not typical parts of the modern Western diet. If you're relying on the multivitamin aisle at your local pharmacy in the U.S., you're probably getting the wrong form entirely. Real cases exist where patients who were not responding to statins or diet change showed significant improvement in lipid profiles and arterial function once they were given tocotrienols over a period of several months. But again, these are not standard treatments because they don't generate profit in the pharmaceutical system. One man in Texas with early signs of atherosclerosis had no family history and was confused why his arteries were hardening. Turns out he was supplementing for years with only alpha-tocopherol. After switching to tocotrienols and improving his K2 and D intake, his plaque levels stabilized and his inflammatory markers dropped by over 50%. These stories are buried under layers of outdated guidelines and misinformed advice. People are being told they re-healthy when they re-supplementing with the wrong compounds that actually increase risk. What makes this even more disturbing is how many medications commonly prescribed in the United States actually deplete these essential vitamins, without patients ever being warned. Diuretics like furosemide, AC inhibitors, metformin, statins, proton pump inhibitors, and even birth control pills. All of these can strip your body of critical nutrients like B1, B6, B12, magnesium, and folate. Patients trust their doctors. They go in for a checkup, get a prescription, and believe they're protected. But what they were not told is that some of these drugs are depleting the very nutrients their heart needs to survive. This is especially dangerous for older Americans, many of whom are on 5 or more medications. By the time they reach their 60s or 70s, their nutrient stores are already depleted, absorption is lower, and medications push them even further into deficiency. One retired nurse from Florida, who followed all her doctor's instructions, ended up in the ICU with a heart attack. She didn't smoke, wasn't overweight, and walked daily. What was missed? Severe B1 and magnesium deficiency from years of diuretics and PPIs. No one ever warned her that the very medications meant to protect her were silently draining her heart of what it needed. In Canada and the United Kingdom, the situation is similar. Elderly patients are often polymedicated, and nutritional monitoring is almost non-existent in routine practice. In Australia, the guidelines mention drug-nutrient interactions, but they are rarely applied in primary care. The system is reactive, not preventive, and because of that, the most dangerous deficiencies remain unrecognized. B1 deficiency alone can cause symptoms that mimic heart failure, shortness of breath, fatigue, swelling in the legs. And yet, instead of checking thiamine levels, patients are placed on more drugs, more diuretics, more beta blockers, more burden on a heart already starving for nutrients. Stress also plays a massive role in how these vitamins are used by the body, and this is almost never discussed during cardiology appointments. Chronic stress, which is epidemic in the U.S., increases the demand for B vitamins, vitamin C, and magnesium. The adrenal glands burn through these nutrients faster than the body can replenish them. Under stress, blood pressure rises, inflammation increases, and cortisol levels remain elevated. That alone weakens arterial walls and increases clot risk. But combine that with low vitamin C and B vitamin status, and you have a perfect storm. One man from Ohio, 38 years old, had no family history, but collapsed at work and died on the way to the hospital. He had been under severe job stress, skipping meals, surviving on coffee and fast food. Autopsy showed severe arterial inflammation and low B6 and B12 levels. Another woman in Ontario, just 42, suffered a heart attack during a divorce and was later found to have critically low folate and vitamin D. Her doctors had never checked them. In both cases, stress combined with silent deficiencies was the real cause, not bad genetics, not poor cholesterol, but unmonitored nutrient loss under chronic pressure. Nutrition in the American diet is another major driver. Ultra-processed foods, which dominate grocery stores in the United States, are stripped of vital nutrients. Even when foods are fortified, they're often fortified with the wrong forms, like synthetic folic acid instead of methylfolate, or cheap alpha-tocopherol instead of tocotrienols. The USDA allows products to be labeled as containing vitamin E, even if they contain only one isolated and potentially harmful form. Meanwhile, the average American is eating fast food 3 to 4 times per week. In the United Kingdom, prepackaged convenience meals dominate, and in Australia, highly processed snacks and cereals fill lunchboxes. In Canada, the majority of calories still come from refined grains and added sugars. The result is a population chronically deficient in the very nutrients required for healthy arteries, clot prevention, and cardiac resilience.